Hi, I'm Dr. Kurt Woeller. Let me expand on this concept of GI issues, GI problems with people with rheumatoid arthritis. So we talked about bacterial infections, specifically trying to evaluate for the presence of Clostridia, Clostridia difficile, and other Clostridia bacteria. Also doing a thorough stool analysis for parasitic infections is important too, whether you're looking for something called Giardia, Entamoeba histolytica, Cryptosporidium. That's also important. The other thing that's important is identifying food sensitivities. We know that food can cause allergies. We see that a lot with people who have a citrus allergy or shellfish allergy. But what goes underappreciated in the medical world with respects to autoimmune disorders is the potential onset of immune reactivity because of underlying food sensitivities, whether it's to gluten, to dairy, to rice, to some other type of grain, to certain vegetable. Sometimes people react to meat. And so one of the assessments that I do is looking at a food IgG analysis, not to detect an allergy per se, but to detect an immune sensitivity that could potentially be a triggering event for inflammation in the body. And this is critically important to get a broader view of food reactivity. Now, gluten intolerance is its own category, if you will, of food reactivity that needs to be analyzed. And I'll talk about that in the next video, about some things that can be looked at with respects to gluten intolerance, wheat allergy, etc. But I want you to think about a broader way of assessing for an underlying laboratory assessment for rheumatoid arthritis is doing a further digestive stool analysis to look for other infections, as well as looking to do some type of food sensitivity profile that can help identify food sensitivities. And by the way, one of the labs that I use to do this, actually you can do a blood test off of a finger prick. Just simply doing a finger prick test in the home to analyze for food sensitivities is very convenient and very effective. Thanks.